Hi, thank you. I'm just going to attempt to share my screen with you. He says confidently. There, so I'm hoping, yeah, okay, Fahana's nodding, so I'm hoping you can see that. And I'm hoping you can hear me, okay. More nodding, okay, good. Great, so thank you. So as the title suggests, I'm going to talk about ethics and governance in social care research, and there was definitely some more virtual nodding when Jennifer was talking about the nature of the people watching are either going to be either helping to put together or reviewing applications for funding. So I thought the best thing to do was to sort of simply take you through the process of applying for ethical approval in social care research, and essentially the different things that sort of need to be considered when you're doing this. There are a few different stages. There's various organizations and bodies that can be involved and that can apply to your research depending on the kind of research that you're doing. And that way, hopefully, you'll be able to sort of then go on and provide some guidance on this yourself, and also to be able to provide some of this information or help provide some of the information that's necessary in a funding application, and thereby sort of showing that essentially you know what you're doing and what steps are involved, and that when you present your work for funding, hopefully people will want to do just that. A little bit of a warning, it's just to say that it's very much pitched in a way that assumes really next to no knowledge of the process or of social care. So I apologise in advance if this is telling some of you at least how to suck eggs, but it's kind of very much pitched as a beginner's guide. So I hope it's going to be useful to you. So if you're thinking about applying for ethical approval for a research study, really the very first and simple question you need to ask yourself is my project research? And in many cases, I'm sure, especially talking to this audience, the answer will be yes. But it can be a little more difficult than it sounds. And to check this, you can use the Health Research Agency's decision tool to help you. There's a link here, but I know you'll all get the slides, and all these links will be clickable, and I've done a kind of slide at the end which includes all of these. So this is a link to the Health Research Agency's decision tool. And so, I mean, firstly, you might be wondering why I'm talking about Health Research Agency when I'm supposed to be talking about social care research. But some of these initial stages, at least, are very similar, and they do involve kind of very similar process. So, so onto this tool, the important thing to say about it really is that it will only tell you whether or not you need approval from an NHS REC specifically. So it won't tell you whether or not you need approval from another regulatory body or other ethical approval from, for example, a university ethics committee or another internal committee. It won't tell you those things. It will ask you a number of questions about the study that you're doing. The first question it will ask you is, are participants going to be randomized into different groups? And so with randomization, this is much less common in social care research than, say, for example, in a clinical trial or other epidemiological studies, although it's not unheard of, and I've certainly worked on one study which did exactly that, randomize people into different groups, but it's much less common in social care research, and not as likely that you would answer yes to that question. But you'll also be asked whether participants' treatment or their care or any services are being changed. This is slightly more likely, especially if you are wanting, for example, to study the impact of a different type of care or a different way of even organising that care. So, for example, the way that budgets are organised or funds are given to individuals, all of this sort of organisational stuff would be considered as kind of changing perhaps the way that services are being delivered. So you might answer yes to that. And then the last question, or the third question here at least at this stage, you'll be asked is whether or not your study is designed to produce generalizable or transferable findings. And it's probably the question that you're most likely to answer yes to, since the purpose of any or many social care research studies is to see whether or not something works. So whether it's a service, a specific approach to service delivery, or another way of organising that delivery or care service, and how well it works, or with who does it works, and therefore how it might be applied kind of elsewhere. So it's important to sort of think, don't get caught out here, because while your study might not be generalizable per se, which in this context specifically means that findings can be reliably sort of extrapolated to a much broader population of users and applied to different settings outside the study. But they are much more likely to be, say, transferable. For example, the findings of a qualitative study could be applicable to a similar context or a similar setting. And a lot of qualitative studies, for example, are not necessarily generalizable, but would be considered to be transferable. So if you're not sure, after sort of going through this process, you can contact the HRA. You can also contact your local clinical research network, which would be Kent, Surrey and Sussex, CRN. I'll talk a little bit more about them a bit later. But assuming that at least one of those questions applies to you, you've said, well, at least yes to one of those, then effectively you're doing research. But an additional question is whether or not you'll have to submit that to an NHS rec for review. And again, the HRA will help you here, and they'll ask you a further series of questions, some of which will probably sound a little bit odd if you're used to doing social care research. So they'll ask you questions like, are you exposing any of your participants to ionizing radiation? Which I'd be surprised about. And if you're talking, or whether or not you're taking tissue samples and things like that, and equally I'd be pretty surprised about that. But some of the questions, and many others, are more obviously related to a clinical trial, but eventually you'll see some questions asking whether or not you're including past or present users of adult social care services in the study, which is more likely to be yes, or if not, then perhaps even relatives or carers of past or present users of adult social care. One exception to this at the moment is if you're including only providers of social care services. So, for example, you could be interviewing managers of private care homes or local authority social care commissioners, and not involving users in any way, shape or form. Then you won't need to kind of complete a REC application, as it were. We'll come on to kind of what else you need to do as we go through. So if you are familiar with doing health research, then this will all be very familiar to you. So I'm not going to talk too much about this, and indeed sort of the next steps. But effectively, what you then need to go and do is complete and submit your IRAS form. IRAS being your Integrated Research Application System. And this is the same as what you would do for any other research study. And like this, once your application is ready, you contact the central booking system, you book a meeting, you add the REC meeting details to your form actually, and your ID once you've got that after you've telephoned the CVS, and then you submit your form electronically. So for social care research, there used to be really only one option for you in terms of your REC, and that was the Social Care Research Ethics Committee, or the SCREC, as we refer to it as. And this is still active, and it's still very handy, especially for Kent, Surrey and Sussex, especially because it's based in London. It's based in the Department of Health. It does deal exclusively with social care research. It's chaired by Martin Stevens, who's a senior research fellow at King's College London. He's got lots of experience in doing social care research, understands the issues, and the committee similarly, more broadly, has lots of members who are experts and have lots of experience in social care exclusively. That has changed though, and now there are a number of RECs all around the country that will include social care research in their committee flags, or this is basically their specialisms. So you can look these up, and again, there's some links at the end for getting onto these. So basically you just need to check what your particular REC that you're thinking of applying to, what they call them committee flags, but what their specialisms are, and make sure that one of those is social care research. I say this because the situation that you really want to avoid, and it's happened to me, is a bunch of epidemiologists, not that I have anything against them, but they're scrutinizing your study, and they're not necessarily familiar with the social care research world. And in the past, I've sat in meetings where someone's asking me what power calculations I'd done, for example, for my sample size, when I was doing a purposive sample of qualitative interviews. So, it really didn't apply, and they really didn't understand why I hadn't done the power calculations, and it becomes difficult. So just make sure that you select a rec that has that kind of specialism. Also, another note of caution is that it's worth, some committees have they might have particular aversion to some particular methods or tools. They shouldn't do necessarily, but because they are made up of people and people have different ideas and different views, that they sometimes, some committees will be more, let's say, open to you doing a method like observation, for example. And so if it's worth trying to check where you can, if someone else has an experience of going to a particular committee and have used similar methods, how they were received by that committee. So it's just kind of a top tip, really, because they, as I say, they can differ, or they can and do differ. Or did I mean to do that? There we go. So let's see, where was I? So essentially, yeah. So you've got the rec. They will ask you to attend a meeting to provide any clarity and prevent any unnecessary delays in approval. It's really worthwhile going along to the meetings. You don't have to, but it just makes the process a lot easier, a lot smoother. They might just have a small question for you, which is something that they've misunderstood or just hasn't been massively clear in the application. So you can save a lot of time by just going along and sitting in on the meeting. So getting into some of the differences between health and social research. Now, this social care is obviously largely funded by councils. Now, notwithstanding some of the changes and attempts to combine health and social care budgets to produce kind of these more joined up services, but largely we can still say this is provided by councils. Of course, the other caveat is it's not free at the point of delivery like healthcare is. So to obtain council funded social care, you're assessed on two things. You're assessed on your care needs and your ability to pay. So if your needs are assessed as being great enough, or they're not assessed as being great enough, or you've got too much money, then essentially you're assessed as being not eligible for the local authority funding. And in that case, you go away and you do whatever else you want, which makes you a self-funder, which makes life difficult for us researchers. It means it's much harder to find out how and what you are doing to meet your needs. And there's probably a whole other presentation related to that. But the reason it's important to understand the kind of funding side of things is to understand why might the local authority want to know about your research. And so that effectively is to safeguard users, but it's also to monitor the research burden on their own staff. So for example, if they've got staff members who are busy helping you collect data or recruit participants on lots and lots of different studies, then and obviously they need to make sure, the local authorities need to make sure that their staff aren't being overburdened effectively. So when you do this, when you're applying for research governance approval, the requirements really can be extremely variable in terms of the information that they want and how much of it they want. So all of them will want to see your SCREC or REC approval if you've done that. And if you're lucky, that's all they will want to see, and some will do that. Some will sign off purely on the evidence that it's been through a SCREC or REC, and that's evidence enough that it's been scrutinised by a relevant ethical committee, and then they'll just sign it off extremely quickly. If you haven't had to go through SCREC or a REC, then they will most likely want to see that it's been looked at by either an internal committee like a university one, whether it's been peer reviewed or even reviewed by a sponsor. And also, if you haven't had to go through the rec approval process, then they'll probably want to see some evidence that as to why you've not done that. And that's very easy. There's a printable, downloadable form which shows how you've answered the questions that I was just talking about, and how the HRA have deemed it that it's not meeting the criteria for them to have to review it. So again, the application forms, these can be really variable. Some people do it, some do it online, most do it online now. Some are downloadable and editable. There's very few postal ones left, I don't think. They really can range. I've seen them that are just a few pages long, and I've also had to complete ones that were 90 pages long. So the good news is that if you have applied to a rec, then a lot of this information is directly relevant and you can just simply copy it across. And yes, it certainly sometimes feels like a bit of a pain when you've already gone through one committee and then you have to go through another one, and it's really painful when they pick up something that the other committee didn't pick up on, and you end up saying, well, why was that not an issue in one committee where it's become an issue for the research governance process? And that can be because of local reasons, of course. So where a rec or SQUEC might not pick something up that is particularly applicable to a local scenario. So that's most likely when that will happen. And so, yes, and then we've got sort of contacting the departments. So local authorities used to, and should probably still have, a dedicated research governance department. This, unfortunately, is increasingly not the case. Organisations have obviously been reorganised or streamlined, to use the euphemism, and have lost some of these departments. But nonetheless, it's really important that you at least get someone, even if it's very difficult to kind of find a person. I've had people where they didn't realise that it was their job to sign off on these research governance proposals. But, you know, and I've also had ones where I've had to go to the director of the local authority, who has then signed it off. And it's, you know, it could just be an email that they've sent, as long as you've got some evidence that, you know, the local authority are aware of and have seen the research proposal and are happy for it to go ahead. Then you can do it like that. But obviously, if there is an official process, then you'll need to kind of go through that. The last thing on this list is ADAS, which is the Association of Directors of Adult Social Services, and that won't apply for small studies, but many will want you to have that approval, and will certainly look upon it much more favourably if you do. And I realise this might be something that you're not familiar with, so I'm going to talk a bit more about ADAS here. So effectively what ADAS are is they are a charity. They're a leading independent voice of adult social care. They work to promote higher standards of social care services, and they influence policies, decision makers to transform essentially and help the lives of people who need and also provide care. So they exist essentially to ensure, according to at least their own mission statement, that anyone that needs care and support can live the lives that they want, regardless of age, disability, status, and social background. The membership is drawn from serving directors of adult social care that are employed by local authorities. Associate members are also past directors, and wider membership includes kind of deputy and assistant directors. And last year, I think, 2019, the membership was extended to principal social workers as well. So they can also be members. So I say it won't apply to studies that are relatively small or just happening in one local authority. So ADAS, you'll only be able to apply to ADAS if your study is happening across 4 or more local authorities. If it's just one, for example, you're not eligible. They will then review it. It's normally relatively light touch, and they will support your study provided it meets with their sort of general aims and their ethos, which I found that they always have. There's no longer an admin fee. There used to be a fee for applying, which was £750, but there's no longer a fee anymore. And I mean, often, given the number of requests that are received by local authorities from researchers, a lot of directors will only consider engagement with your work if it has been considered and endorsed by ADAS. So it's a really, really good way of kind of getting your study endorsed. To have it endorsed by ADAS will really help you. Again, it's another application form, the ADAS process. You can download a document or a PDF. You'll need to include all your research proposals, supporting materials, other approvals if you've had them, all your research tools, participation, consent forms and such things. They'll then review it. It then gets submitted to the ADAS Executive Council for approval, and then if your application is relatively straightforward and appropriate, it'll then be submitted for approval at the next Executive Council meeting. So just to be clear about some of the timescales, so to ensure that your application goes before the next Executive Council meeting, it has to be submitted at least 5 weeks prior to the meeting date. So just be aware that there are some timescale issues. Okay, so Mental Capacity Act I want to talk about next. This is really important. Just to say that this just applies for England and Wales. There are different processes and terminology used in both Northern Ireland and Scotland. I'm not going to explain those here, but it's just really important to flag them up in this presentation, that this only applies in kind of in England and Wales. So the first thing to say about the Act is that it applies to all decisions taken on behalf of people who permanently or temporarily lack capacity to make such decisions themselves. And crucially, this includes decisions to include people in research. So researchers and others making decisions about involving people lacking capacity have a legal duty to have regard to the guidance and the code of practice. So if you are doing this in your research, if you're recruiting participants that lack capacity, you will need to be familiar with it. It's comprised of a number of core principles, which you can see here. So a person has to be assumed to have capacity unless established otherwise. They should be helped to make their own decisions as far as practicable. They should not be treated as unable to make a decision simply because they might make an unwise decision. Those are two very different things. And all decisions and actions must be in the best interest of the person lacking capacity. And they must also be least restrictive of the person's rights and freedom of action. So researchers working with people who lack or may lack capacity, and this is really obviously a big thing in social care research for things like dementia, and they need to be aware of the underlying principles and the provisions relating to the research. And there's a code of practice, there's a link to the code of practice at the end of the presentation, so you'll be able to find that. And the study protocol should describe the procedures for recruiting people that lack capacity and include arrangements for identifying and consulting consultees. The consultees being a person or persons who are able to take decisions on behalf of the person that lacks capacities. And these are generally split into personal and professional consultees. So a personal is, it could be a spouse, a child, a neighbour, another family carer. A professional consultee can include a GP, a social worker, advocacy member, a solicitor, and others as well. Okay, so what are the requirements for approval? So the approval criteria is set out in section 31 of the Act, but essentially the research has to be connected with an impairing condition affecting the participant or their treatment. It needs to be the case that the research that research of equal effectiveness could not be carried out if confined to participants with capacity. So in other words, that you wouldn't be able to do the research that you're wanting to do effectively if you only included participants that had capacity. That's really important. And then the research must either A, have the potential to benefit the participant without imposing a disproportionate burden, or B, provide knowledge of the causes of or the treatment or care of others with the same or similar condition. And in this case, the research must involve negligible risk to the participant. So it can't interfere significantly with their freedoms or action or privacy, or be kind of unduly invasive or restrictive or anything like that. Now, the Mental Capacity Act is a really good thing, but it can create challenges for social care research. And again, in any ethics application, you're really going to need to demonstrate that you've understood the Act and how it applies to your work. They will really scrutinise this, and they will really pick you up on it if they think, they being the ethics committees, if they think any aspect of this has either been misunderstood or you're not applying it in the way that it should be applied. And there's other definite challenges around this. It can be really difficult to get personal consultees. And it can be equally difficult to get professional consultees. I mean, imagine trying to get a GP or a consultant, especially at the moment, but even at the best of times, excuse me, to go through an information sheet, decide if they think that their patient would like to take part, get it signed and get it back to you. I think, most people would agree it's an extremely difficult thing to do. So you have to, again, build into your timelines time for doing this when you're doing when you're setting out the timelines for the research, especially if you're using consultees. And again, what we found, or what I've found in the past, is people can sometimes be, they can sometimes take a fairly protectionist view, that they need to be aware that they need to take account of how they think the person would feel taking part in the research. It's not about the consultee, it's about the person that they represent. So the consultee, for example, they might not be bothered about taking part in research, but they really need to think about the person that they represent and whether or not it's the sort of thing that they would like to do. And that has to be really clearly spelled out in things like invitation to take part letters and information sheets and things like that. And here's a kind of a final warning, I suppose, in relation to the MCA is some committees really feel that you have to absolutely go over and above justifying why you would include people who lack capacity, and they can take quite a paternalistic view. So sometimes you might have to kind of fight your corner a bit. I mean, the difficulty is, I think, where some committees might take that view. Yeah, if you look at care home residents, 80% have dementia. So it's really important to emphasise that it would actually be unethical not to represent their views and experience, because without including these people that lack capacity to consent, that they will then not have a voice at all. So I think the argument you can make is that it would be unethical not to include them, as opposed to being perhaps a bit too risk averse and saying, no, we're going to exclude everybody. I don't know, I'm running out of time. Okay, so quickly, what's going to be considered ethical review? So it just shows the types of things that committees will look at. They'll look at the purpose of the study. Can you justify it? Has it been done before? They'll look certainly really clearly at the methodology, your data collection, your recruitment. How are you going to invite people to take part? You need to send your letters, your invitation letters, your information sheets, your consent forms, the research tools that you're going to be using, the measures that you're thinking about using. They're going to consider the burden on the service user, the carers and the staff. Data storage, it has to comply with GDPR. Now, you could do kind of a whole day on that almost, about GDPR, but effectively what it means is, that you've got your assurances of confidentiality, anonymity, that your data is going to be stored on secured servers. It's not going to be moved around on laptops and left, and all those types of horror stories that we've all heard in the past. It's things like physical consent forms being securely locked away in filing cabinets. They'll look at also just the management of the study. So is there an appropriate kind of PI, co-PI? What's the supervision like? Is all of that appropriate? So those are the kinds of things that will be looked at by the committee. So I've gone through that a bit more quickly than I wanted to, because I'm suddenly aware of the time. So just lastly, here's some useful links, all of which I've talked about kind of throughout. The other last thing actually is just timelines in general. It's the question of that is kind of how long is a piece of string, really? I mean, from the point of submission, recs, 3 months is kind of doable with a straightforward one, but it can easily change. Research governance, as I said earlier, can be extremely variable, and it largely depends on the number of sites in your study. So I've done it very quickly in the past, but it's also taken me 9 months to get research governance approval from essentially all local authorities in England. So just be aware of that, and build it into your timelines. I explained, I think, the process in ADAS, and so I think I'll better stop because I'm going over on time. So thank you.
Thank you, James, so much for your presentation. You've given us a lot of food for thought. It's a very different terrain for us to get our heads round. We have time for 2 questions, and it's through the chat function. There's one from Wendy, who's asked if research will be carried out in the NHS and also social care settings. Does it require both types of ethical approval?
Yeah, I'm afraid it does. Yeah. But I mean, again, often what will happen will be if you've got an NHS approval or a REC approval, then a lot of the research governance will sign it off on the basis of that. Not all of them, but some will happily say yes. If someone else has looked at it, we don't need to. But the answer is yes.
Thank you. And just one further, I think it's just flagging up from Jennifer, and she's saying it might be worth telling the audience that their clients will need to apply to MCA flagged REC for approval. I'm not entirely sure what that acronym stands for. Explaining.
Hi, James, it's Jennifer. Can you hear me?
Yes, I can. Yeah.
Yeah. Sorry, it was just as you were going through the MCA, presumably that it might be worth telling the people to tell their clients that they need to go to an MCA flagged REC.
Yeah, no, it's a very good point. Thanks for raising it. Yeah, so
when which mine is one. So come to ours.
Pardon?
Of which mine is one. My REC is one. So come to ours.
Okay, good recommendation. But yeah, no, that's a really good point. So have a look at the flags, have a look at the committee, what their flags are, and ensure that if you are asking people that lack capacity to take part in your study, that you go to a REC which specialises in that. Thanks, Jennifer.
Okay, well, thank you so much, James, for your talk today, and you've given us a lot of ideas how we can carry that forward.